From WWL TV, the spirit of Louisiana, this is Louisiana's news leader, Channel 4's Eyewitness Morning News.
As we've said before on the program, health reform has been a hot topic on Capitol Hill and around the country for weeks as President Obama continues his push to try and overhaul the nation's healthcare system.
We recently had a chance to talk to Donald Palmisano, a local doctor and former president of the American Medical Association, who is now part of a grassroots medical coalition weighing in on the proposals making their way through Congress. And Rob Nelson sat down with Dr. Palmisano to get his take on the current debate.
Dr. Palmisano, thank you for being with us. We certainly appreciate it. One of your main concerns about the reform package being talked about right now is the public option, essentially the government getting involved in the healthcare industry, so much so that you said that if it passed, it would be the virtual end to medical innovation and discovery. Explain why such strong opposition to that part of the package.
Well, I think the public option is really the government option. What happens with that is that the government sets the rules and the government is the umpire. When they speak about leveling the playing field, you have the umpire, it's on the government's team. And soon, the rules will be set and there will be no private insurers. And we know that when the government gets involved, what we end up with is more money spent, deficit spending, and we know that patients end up with a substandard system.
One of the points the president made last night, though, is in terms of the competition, that if there are still insurance companies making billions of dollars in profits, in some cases record profits, why isn't competition healthy?
Well, competition is healthy, and that's the three things that I see wrong. If you take the bill that came out of the three committees, the tri-committee bill, H.R. 3200, what that does is, number one, it has the government option in there, which will destroy the private insurance industry. Number two, what it does is violate our rights as citizens, the right to privately contract, the hallmark of the free enterprise system. So right in the plan that's coming out of Congress, you and I, if I'm the doctor, you're the patient, or you're the doctor and I'm the patient, you and I can't agree. I can't say, oh, don't worry, Rob, just forget the copay. That's a federal crime under Medicare right now. And by the way, let me just stop there and say that when Medicare was passed, the government said in Section 1804, for those who want to go check the details, 1801, I'm sorry, it says no federal interference in the practice of medicine. And that has become a joke. The government really interferes in Medicare and Medicaid. And the third thing is not going to reduce the cost. There's only one way to reduce the cost of medical care. First off, we pay more money because we have high-tech things. When I was a young doctor, someone had a heart attack, you gave the person morphine to help with the pain, and you put them in an oxygen tent, and you said some prayers. That's about it. But now we have high tech. You can do an angioplasty, you can do aortic coronary bypass, whatever's necessary, and you can extend life. But the only way we can fix the system is to allow each patient to own their own policy and find out what the true number of uninsureds are, help those people with tax credits or subsidies, and let them pick their own policy, like the Federal Employees Health Benefit Program. They will own their policy, and they can then be prudent purchasers. And then you will see if the insurance company doesn't treat you right, you say, tell you what, I'm not going to renew with you at the next renewal period. You don't have job lock. No matter what job you go to, you got your own insurance.
What parts of the current package do you like? What's good about the bill?
Well, what's good about the bill is that it attempts to address those who don't have insurance. That's one thing that's good about it. Number two, it addresses a very important issue, which is the issue of people who have conditions like diabetes or whatever, and they go for insurance, and somebody says, we're not going to allow you to come into our insurance plan. But there's a better way to fix these things. You could have purchasing cooperatives, voluntary, where instead of me, if I have diabetes, just going there and trying to get insurance, I could join with you and 500 other people, 1,000 people, and we could go and say, as a package deal, Rob's in great shape, but Palmisano has this problem, but you're going to take us as a package deal.
And we're low on time. Let me ask you this. News this week that obviously they're not going to pass this before the August recess. You consider that to be a good development? You want to see them take as much time as possible?
Yes, sir. Because I, as a surgeon who did abdominal aortic aneurysm resections, I didn't get praise for getting out the operating room quick. I got praise for getting out the operating room for having done the right thing to save the patient's life.
All right, Dr. Palmisano, we appreciate you being here.
Okay.
Should be an interesting debate on Capitol Hill the next few months.
Right. Thank you very much, Rob.
Thank you. Appreciate it.
Okay, buddy. Thanks. Good.